Chapter 10: Autoimmunity and the Leaky Gut. Conventional wisdom about autoimmune diseases are the black box of medicine, remaining in its blind spot because medicine refuses to look at autoimmune disease from a new perspective. Allopathic medicine does not realize how significantly the gut affects the brain or the immune systems, but once they do, it will revolutionize medical advancements. The gut is the battlefront for most Neolithic diseases, as it is the most significant way we interact with our environment. First, you must realize that many doctors have never even heard the term leaky gut syndrome. There is no diagnosis of leaky gut in any medical textbook because the connections between the gut and the brain are not well studied by medicine. Physicians, however, do learn about altered guts in ICU conditions. So, if you remind them of this fact, you might make some headway with them. If your doctor worked in an ICU during their training, they will be quite familiar with gut health in relation to severe malnutrition, burns, bacterial LPS endotoxemia, and in long-term total parenteral nutrition nutrient IVs, all of which lead to a breakdown in the intestinal brush border. The interesting thing is that few doctors seem to realize this disease shows itself far more commonly in our clinics than it does in the ICU. I believe it is the most common syndrome I see in my neurosurgery clinic today. I also believe medicine will soon link gut health with disease because the current gastroenterology literature is now reaching into this area of science. Gut health affects every system in the body. Inflammatory bowel disease, IBD, and Crohn's disease deserve special mention because conventional wisdom says neither is tied to diet, despite the large amount of currently published evidence. If you have one of these diseases, you would be wise to immediately employ an autoimmune paleo diet that eliminates all grain, dairy, and legumes. Risks associated with leaky gut to be aware of. A. Foods high in the glycemic index and most dairy products, raw or pasteurized B. Foods high in refined flours, processed foods with low fiber content C. Chronic caffeine use D. Excessive use of alcohol or long-term use or abuse of antibiotics for any reason E. Chronic use of drugs such as aspirin or ibuprofen, all NSAIDs. And all proton pump inhibitors F. Mercury-laden foods or any environmental toxins G. Any disease that causes an altered consciousness, trauma, delirium, dementia, stroke. H. Chronic or acute food allergies, severe food poisoning, vitamin D levels below 20 burns, excessive training, malnutrition, asthma, eczema, aphthous ulcers, canker sores, pemphigus, skin blistering, lupus, diabetes, and obesity diseases linked to leaky gut. 1. Inflammatory bowel diseases such as Crohn's, ulcerative colitis, multiple sclerosis, rheumatoid arthritis, and Hashimoto's thyroiditis 2. Diverticulitis, also very high 6:3 ratios, GERD, and eosinophilic esophagitis 3. Fibromyalgia is an inflammatory disorder that can be screened for with a visual contrast sensitivity test. Our fat cells store these neurotoxins, and when they are released, they circulate through fat-containing tissues, wreaking havoc. Producers of these toxins include dinoflagellates such as Piesteria, Ciguatera, and Shadonella, fungi, including Stachybotrys and Fusarium, bacteria such as Pseudomonas fluorescens, spirochetes, including Lyme disease-causing Borrelia, blue-green algae, such as rapidly reproducing Microcystis and Cylindrospermopsis. 4. Degenerative disc disease of the spine and inflammatory spondyloarthropathy. Cluster headaches 5. Multiple sclerosis, ALS, Alzheimer's disease, Parkinson's disease, migraines, and atypical headaches 6. Overtraining and adrenal fatigue leading to low 24-hour cortisol, changes in normal diurnal rhythm 7. Eating disorders, especially binge eating disorders triggered by modified gliadin protein in wheat 8. Depression, schizophrenia, bipolar disorder, autism spectrum disorders 9. Heart disease is primarily caused by a leaky gut leading to low HDL and elevated small, dense LDL. 10. Dental caries and periodontal disease are tied to oxidized plasma 11. Obesity is an inflammatory condition of the brain from a leaky gut and elevated IL-6 and leptin levels. 12. Osteoporosis and HIV infection. It appears HIV gains easy access to the brain from the GI tract. Many physicians know it is a neurotrophic virus, but many do not know that it gains access through our GI tract, where it replicates in the mucosa and overwhelms the liver's defenses. This allows it entry into the circulation, which carries it into the brain to cause the major changes allopathic medicine commonly recognizes. HIV seems to really lower IGF-1 and growth hormone secretion to cause sarcopenia. 13. Gallbladder disease is a disease related to high-carb, low-fat dieting that causes a vitamin K2 deficiency. 14. Chronic constipation from dysbiosis in the gut, specifically in the colon. How do we treat it? The leaky gut Epi-Paleo RX for autoimmunity 1. It's simple. Eat a dairy-free version of the Paleolithic diet and add polyphenol-rich vegetables and lots of leafy green vegetables. It would be advisable to make them all organic to avoid pesticides that could cause a secondary Neolithic disease, such as diabetes, from atrazine toxicity. 2. The SpectraCell Comprehensive Nutritional Panel is an excellent baseline test, as is the Essential and Metabolic Fatty Acids Analysis, EMFA, by Genova Diagnostics. 3. The Hydrogen Breath Test is a simple test commonly used to screen for small intestinal bacterial overgrowth, SIBO.
A.
A hydrogen breath test can be used to diagnose several conditions. H. Pylori infection, carbohydrate malabsorption, fructose or lactose, and SIBO. B. SIBO breath test. Breath testing measures the hydrogen and methane gas produced by bacteria in the small intestine, which is diffused into the blood and then into the lungs for expiration. Hydrogen and methane are gases produced by bacteria, not by humans. The gases graphed over the small intestine transit time of 2 or 3 hours and compared to a baseline. Patients drink a sugar solution of glucose or lactulose after a 2-day preparatory diet. The diet removes much of the food that would feed the bacteria, allowing for a clear reaction to the sugar drink. 2 types of tests may be used, lactulose or glucose. I strongly recommend you go to SIBO.info. Com to learn more about SIBO and the newer research that is being done in this growing area. The intestinal brush border of our digestive tract is akin to the motor of our Ferrari, responsible for the multiple organ failures we see in critical illnesses. If you read the gastroenterology literature from the last 10 years, you'll realize the battle for many organs is fought in the gut. The gut mucosa that lines the small intestines produces various acute phase proteins, gut hormones, and cytokines that affect mucosal health, as well as the function and integrity of remote organs and tissues. The role of the intestinal mucosa in inflammatory and metabolic responses to sepsis and endotoxemia has become very apparent to researchers during the past decade. The intestinal brush border also appears to be a common origin for most autoimmune diseases. Hashimoto's hypothyroidism, the most commonly known autoimmune disease from a leaky gut, is Hashimoto's thyroiditis. Hashimoto's today makes up 95% of clinical cases of hypothyroidism. In the Epi-Paleo RX, Hashimoto's is a gateway diagnosis for future development of many different autoimmune diseases, all of which are preceded by a leaky gut. When a patient comes to me with elevated thyroid-stimulating hormone, TSH, a diagnostic marker for hypothyroidism, and the thyroid peroxidase, TPO, or thyroglobulin, TGB, antibodies, which signal an autoimmune thyroid condition, I get very concerned. When the patient is a woman of childbearing age, I am even more concerned. Autoimmune disorders occur more frequently in women than men because women are more sensitive to inflammation. This is because leptin is higher in women of childbearing age, and it is an inflammatory IL-6 analog. In Hashimoto's, the initial attack to the thyroid gland can be by antitransglutaminase autoantibodies developed in celiac disease or other leaky gut etiologies. Celiac disease may be the initial autoimmune trigger for many other autoimmune diseases and allergies. I believe any leaky gut etiology can cause the problem, hence we need to protect our gut lining from all pathological inflammation. Autism has been associated with autoimmunity in the mother and placental abnormalities. You might be surprised to learn high concentrations of transglutaminase are found in the placenta, which acts as the gut lining for the fetus. It also appears from recent data that supplemental folic acid in grain products may contribute to the development of leaky gut, altered methylation patterns, and increased inflammation in the fetus developing brain. As a result, vitamin D and progesterone levels drop in the fetal brain, setting the stage for poor wiring and connection. Other research shows eggs from an older mother and a mother's low vitamin D and placental progesterone status are critical pieces to understanding the complexities of how autistic spectrum disorders develop. This may help explain why this disorder is becoming more common today. Women are having children later in life, eat a grain-based diet supplemented with folic acid, have low vitamin D levels, and have low progesterone due to inflammation from a chronic leaky gut hindering conversion of pregnenolone to progesterone. Lab data TO review refer back the chapter on lab tests and reread the VAP section to assess a leaky gut. Clues for leaky gut are low HDL, low vitamin D, altered sex steroid hormones, elevated hsCRP, elevated ferritin, elevated cytokine levels, elevated homocysteine, or a missing gallbladder. Potassium and your blood pressure could also be quite low. This is a sign the aldosterone axis, which regulates sodium balance, fluid volume, and blood pressure, is off, which is often associated with a leaky gut. Some people will also have severe abdominal bloating. I have seen women with guts that can expand in a few weeks to look like they are 6 months pregnant. This is a sign that your diet is loaded with something your gut lining cannot tolerate. This is when I strongly suggest cutting all dairy, nightshades, and birth control pills. I have found these 3 are the biggest offenders. Low B12 is also a sign your gut is the problem. If your B12 is below 1000 pg/ml, you need to reassess what you are doing. Musculoskeletal pain is often linked to a leaky gut because of several clinical possibilities, including altered magnesium, potassium, and sodium levels, leptin resistance, low hormone levels that decrease lean muscle mass, or low vitamin D. The cytokines IL-1 beta, IL-8, and IL-12 are often tied to a leaky gut diagnosis. A special point needs to be made about IL-12. It is a cytokine associated with leptin resistance and autoimmunity, and in my opinion is the reason why autoimmunity is more common in women than in men. This is because leptin is higher in women than men due to childbearing. Administration of IL-12 to people suffering from autoimmune disease has been shown to worsen the autoimmune condition because it induces a pro-inflammatory response. In contrast, treatment of mice with IL-12 specific antibodies ameliorated the disease. The inflammation due to IL-8 is tied directly to the altered cortisol levels and the disruption of the circadian cycle of cortisol. IL-8 is so important that its presence with hepatitis C signifies interferon resistance. This fact is lost on many hepatologists, but the implications are huge when treating leaky gut. IL-8 increases all kinds of cytokines, eventually leading to severe elevations of IL-1 beta. IL-1 beta is linked to the development of systemic inflammation and multiple sclerosis, rheumatoid arthritis, and Hashimoto's. I have seen the worst cases in women with hepatitis C because they have a leaky gut that cannot be cured due to the ongoing inflammation stimulated by the viral infection. There are some new treatments coming, such as protease inhibitors and pyrimidine inhibitors, but we do not know the long-term effects of these treatments as yet. The protease inhibitors recently approved attack a hepatitis C virus enzyme. The virus needs to make new copies of itself. Each of the drugs brings virus replication to a near halt. The unfortunate thing is they have to be used in combination because hepatitis C quickly becomes resistant to them. They also have a very steep side effect profile. One has to accept this because the hepatitis C virus raises the risk of many Neolithic diseases. Leaky Gut RX for Autoimmunity Prevention A. Use grass-fed bones to make a bone broth with coconut oil. Make sure the bones have meat, cartilage, or tendons on them. I like cuts through the joints because it has more L-glutamine than just long bones. This is a core treatment for any leaky gut. Glutamine decreases IL-4 in the brush border to restore health. This is the most critical step in leaky gut repair. If your IL-4 levels are elevated, you know you have a leaky gut for sure. For example, I have yet to test a diabetic who did not have elevated IL-4 levels. The effect of the broth is so brisk that when the body is facing a lipopolysaccharide, LPS, bacterial infection, the medium-chain triglycerides, and CT, in the coconut oil will re-establish brush border integrity. This is but another reason why coconut oil and MCT oils are critical elements to the Epi-Paleo RXB. Use non-GMO coconut oil as the main fat in the diet until the syndrome is reversed. MCTs significantly blunt pro-inflammatory cytokines such as TNF-alpha, IL-18, macrophage inflammatory protein 2, and monocyte chemoattractant protein 1 in the ileum. In addition, research showed the mRNA expression of the IgA-stimulating cytokine IL-10 in the ileum and Peyer's patches was significantly greater in those using MCT. C. Use probiotics liberally if the patient is conscious and not in ICU. Use fermented foods first before going to live culture additives. Examples are sauerkraut, pickles, kimchi, kombucha, yogurt, kefir, artichoke, and horseradish. D. Consider use of probiotic additives with Lactobacillus acidophilus, bifidobacteria, and Saccharomyces boulardii. E. You might also supplement with fructooligosaccharides, FOS, powders and supplements. These compounds are found naturally in the foods mentioned above in Part C, but one also can buy FOS. FOS helps feed the probiotic bacteria in Part D, allowing them to flourish and replace the bacteria that foster inflammation at the brush border. F. Consider supplementing with L-glutamine. Sir Hans Krebs, famous for discovering the Krebs cycle, also found that glutamine improves functioning of the intestinal brush border and the gut-associated lymphoid tissue, GALT, the immune system of the digestive tract. Glutamine is critical for immune regulation of intestinal IgA antibodies that attack viral and bacterial pathogens in saliva, tears, and in mucus. Glutamine also normalizes cytokines associated with allergies.
Kruse
2000. Fakatsu et al. 2001. Also, MCTs slow down the immune response in the brush border, reducing inflammation and encouraging upregulation of IgA production, a protection from bacterial or fungal invasion. Vitamin A further prevents the decline in IgA and is a cofactor in the conversion of LDL cholesterol to pregnenolone. This is another reason why pregnenolone, progesterone, and DHEA levels are low in autoimmune disease and leaky gut, and why these people tend to suffer with low cortisol and adrenal fatigue. My belief is that adrenal fatigue is a condition of subacute leaky gut syndrome. I believe serious autoimmune disease is the end result of chronic intestinal inflammation, and we can use hormonal responses to tell us where we're heading. If these inflammatory responses are allowed to chronically feed forward, it leads to massive local and systemic damage. Since it is clear these inflammatory responses are reactions to chronic gut irritants, it suggests the process can be stopped and reversed. I believe this is precisely what Walls discovered when she reversed her own multiple sclerosis. G. Other supplements you might use to combat this syndrome. Aloe vera at 2 teaspoons, 10 milliliters, 3 times a day. This is a major natural fiber, however, and is not to be used with Crohn's, ulcerative colitis, or intestinal blockages. You might also use 600 milligrams of N-acetylcysteine, NAC, in combination with 1,000 to 2,000 milligrams of vitamin C. You might even consider vitamin C infusions intravenously. NAC is the precursor for glutathione, one of our body's main antioxidants. Some people with severe disease may need intravenous glutathione treatment. Low glutathione levels also correlate with positive serum antibodies for diseases that are not active. A glutathione deficiency compromises our ability to keep old viruses dormant and fight off bacteria. This is why so many people test positive for Epstein-Barr virus, EBV, cytomegalovirus, CMV, HHV, 6 herpes virus, mycoplasma, and chlamydia pneumoniae when they have leaky gut or autoimmune disease.
Ash.
Clinical pearls. My clinical beliefs are that glutathione can stop the replication of any intracellular microbe, including HHV6, chlamydia pneumoniae, and mycoplasma. I learned this from several anti-aging physicians who found that some of their patients were becoming virus-free after using undenatured whey protein for approximately 6 months. This type of whey protein helps restore glutathione levels. It also is effective for weight loss because it improves leptin status. This information is vital to HIV patients who all have leaky guts and is a very cheap and easy way for them to increase their levels of glutathione and assist their antiretroviral drugs to keep viral titers low. It actually works well for many viral diseases such as hepatitis C. The nice thing about this protocol is that you can do it at home for the most part, and you can assess whether it is working or not. Increasing your glutathione levels works even better when you're optimizing your uric acid defense system. 2. Uric acid is a natural antioxidant, accounting for up to 60% of the free radical scavenging activity in human blood. Ames et al., 1981. Uric acid scavenges superoxide hydroxyl radical and single oxygen atoms. Ames et al., 1981. Davies et al., 1986. Uric acid appears to help remove superoxide by preventing the degradation of superoxide dismutase, SOD. SOD is the enzyme responsible for chemically cleansing superoxide from the cell. Pachu et al., 2007. Removing superoxide helps prevent the formation of peroxynitrite, a mitochondrial toxin. This is important for neurodegenerative diseases and multiple sclerosis. The driver of this whole process, however, is the leaky gut. People with leaky guts tend to have low levels of intracellular uric acid and glutathione. You should also know that aging is associated with low glutathione and uric acid. Glutathione is a critical test to run on people with leaky gut or autoimmunity. So are B12 and folate levels. It's really important to know what your levels of folate and B12 are prior to taking any glutathione precursors, as a B12 or folate deficiency will cause glutathione deficiency. This is why I advocate high B12 levels through diet, sublingually, or intramuscular injection if your gut is too damaged for you to absorb it orally. Most people with gut problems can't, and this is why their leaky gut persists. Do B12 drops first, and then folate. You can monitor this at home by observing your urine color after taking a glutathione precursor from any source. If your urine turns a rose or reddish color, then you are excreting too much B12 and the glutathione is going to waste. If your urine is greenish, you are depleted in folate and need to increase that before you add any more glutathione. The more severe the autoimmune disease, the worse the glutathione deficits. This is why we see a strong relationship between low glutathione levels and autism spectrum disorders, depression, and neurodegenerative disorders. Toxins accumulate when glutathione levels are low. So just getting rid of the toxin offers little protection if you are not re-establishing glutathione levels with diet and supplementation. When faced with this problem, another clinical pearl is an alkyd food allergy test. They are typically worthless in my opinion, but the one time they are useful is when you test positive for more than 50 to 75% of foods. Most providers do not know what to make of this, but it is a sign that you have very low glutathione levels. So this is a tip you need to fix this pathway before jumping into the dietary modification. If done correctly, you can see major improvement in 7 days. Supplements that work well in these cases are NAC, alpha-lipoic acid, milk thistle or feverfew, curcumin, and acetyl-L-carnitine. In addition, glutathione is essential in supporting and maintaining the immune system. This is especially critical because the highest level of glutathione and disease-fighting immune cells are found in the gut. Evolution designed it that way because that is where the battle of survival begins. It's where food first interacts with the immune system. Per serving, asparagus, avocados, squash, okra, cauliflower, broccoli, artichokes, burdock root, jicama, spinach, walnuts, garlic, and raw ripe red tomatoes have the highest glutathione content compared to other vegetables and are particularly rich dietary sources of glutathione. They should be what you put in your broths. Leaky gut links to immunity and pain control systems. When glutathione levels are low, patients complain of poor well-being. They feel bad. This is a sign the leaky gut has likely gotten to the brain via the vagus nerve. This raises leptin levels and lowers alpha-melanocyte-stimulating hormone, MSH, a hormone secreted by the pituitary gland that regulates pigmentation, eating behavior, and energy homeostasis. High leptin gradually progress to leptin resistance and inflammation. This is how inflammation is passed from the intestinal brush border to the brain. Often these people report weight loss resistance. When MSH decreases, its effect on the immune system is interesting, which I learned about long ago from the neurobiology of HIV patients. Remember, HIV is a neurotropic virus that best gains access to our bodies via our GI tract. As MSH falls and leptin rises, the endorphin pathways of the brain decline fast. This is what causes that feeling of being sick. Simultaneously, levels of ACTH from the brain fall. ACTH stimulates the release of adrenal hormones, and these people become chronically fatigued with high levels of unexplained pain. The endorphin pathways comprise a class of at least 25 neural hormones that have vast actions in many systems of our body. They are made in both the central and peripheral nervous systems, and in other places, such as the adrenal glands. Diseases linked to a leaky gut also are always associated with low levels of endorphins and endocannabinoids, substances that play a role in appetite, memory, and pain. The HIV researchers in the late 1980s found that 95% of our immune cells have receptors for both endorphins and endocannabinoids. In essence, sufficient levels of these feel-good chemicals help us mount an appropriate immune response to a toxin or pathogen, and low levels make us feel sick. This is even more pronounced when the inflammation is chronic, as in autoimmunity, cancer, mental illness, or viral diseases. The ways we can increase these two systems are to stop the chronic inflammation and stop the leakiness at the brush border. Often, that process takes time, even after the diet is solved. Another tool is high-intensity interval training, HIIT, an exercise strategy that alternates bursts of short, intense anaerobic exercise with less intense recovery periods for 10 to 20 minutes. Meditation or acupuncture are other ways to improve this downside of inflammation. A few other ideas that may surprise you are making your environment cold and eating pure chocolate without mycotoxins. Resveratrol and the polyphenol in chocolate are nothing short of amazing. Another way not well known or used by conventional medicine is low-dose naltrexone therapy, LDN. This blocks the endorphin receptors, stimulating the body to produce its own endogenous endorphins. The effect of LDN only lasts a short period of time. In people with mild cases of leaky gut, it is usually more effective. Those with more serious chronic inflammation tend to have no response to this treatment. These are all options to consider when you have lost your sense of well-being or have chronic lowered immunity. People who respond best often have low levels of vitamin D and moderate IL-6 levels as well. People with serious skin manifestations of leaky gut, such as psoriasis or eosinophilic folliculitis, an itchy rash typically associated with HIV, should consider NAC because it directly blocks IL-4, a main factor in the production of IgA antibodies. IgA antibodies are made in hay fever, asthma, anaphylactic shock, and atopic skin diseases. If the asthma is severe, one can measure the amount of nitric oxide directly in the expired air, and it will be elevated. When this happens, you also see drops in vitamin D. This is why these diseases seem to peak in fall and winter. Most people do not have good stores of vitamin D. Vitamin D levels are chronically low partly because of the beliefs imprinted on us by dermatologists to shield our skin from sunlight with sunscreens. Moreover, lack of antioxidants is found in emphysema, chronic obstructive pulmonary disease, and cystic fibrosis. Karate et al. 2001. NAC will form glutathione and combine with nitric oxide to create nitrous ethiols, compounds related to the dilation of blood vessels and oxygenation of the body. This binding reduces the inflammatory effects of nitric oxide in the body to limit disease quickly. This is also critical for leaky gut. Medicine has yet to make these links. You need to now to protect yourself. They are common mechanisms used in many disease states. Don't worry if you don't understand the science. The bottom line is fix your gut, and disease goes away. Magnesium. Magnesium, zinc, and CoQ10 are all major cofactors in the stress response and used up quickly in leaky gut syndrome. To compensate, supplement with 400 to 1,200 milligrams of magnesium at night, 25 to 75 milligrams of zinc a day, and 400 to 1,200 milligrams of CoQ10 a day, depending upon severity of the disease. They can all be replaced with supplementation, but seek first to get them in your food. If you have an intolerance to magnesium, consider an Epsom salt bath 3 times a week to replenish magnesium levels and add sulfur to your cartilage. This is a key treatment option for those with degenerative disc disease who have low vitamin D and low sex steroid levels. I use this one a lot in my spine clinic. J. Consider liberal use of omega-3 supplements or krill oil, or increase your staxanthin to 4 to 8 milligrams a day, and increase your intake of omega-3-laden foods, such as fresh fish. K. Consider deglycerinated licorice root, DGL. The dose here is 500 milligrams extract, 10:1, 3 times a day. This is an adaptogen that normalizes cortisol levels, but this form is also extremely helpful for leaky gut because it does not have any of the side effects of using whole licorice, such as causing low potassium, low sodium, edema, high blood pressure, and palpitations.
L.
For people with resistant leaky gut, ask your mom if you were breastfed and for how long. If the answer is not at all or very little, then consider the use of colostrum as a consistent supplement. Bodybuilders have long used it to allow them to overtrain while closing the permeability of their brush border. It is that effective. Many people do not realize that exercise can open your gut to inflammation. The reason colostrum works so well is because it's loaded with proline. The proline-rich peptides in colostrum have been shown to support the thymus gland and may help calm an overactive immune system and stimulate an underactive immune system. Also, you can be tested for the following celiac antibodies: immunoglobulin A deamidated gliadin tissue transglutamine IgA. One must remember that the testing commonly done for gluten/gliadin intolerance is not as accurate because of the modifications made to wheat, which is outlined in the literature. So, a negative test does not mean you are free and clear. This is why elimination diets tell you much more clinically, in my opinion. There is no good biologic reason to eat any grain. The Dr. Shoemaker protocol for fibromyalgia, Lyme disease, and chronic fatigue patients, chronicneurotoxins.com, perform the visual contrast sensitivity, VCS, test first. This test assesses optic nerve function in relation to contrast, which assesses the effects of neurotoxins on the patient's system. It evaluates 2 sets of nerves in the eye that differentiate between white, black, and gray on a gray background. It has been found that a person with biotoxin-associated illness will not be able to identify the various patterns. Failure to successfully complete this test is a strong indicator of a biotoxin illness. Though it is possible for a person impacted by biotoxins to pass the test, a false negative result, this occurs only in about 8% of test subjects. Thus, the VCS test supports diagnosis in about 92% of affected people. False positives are quite rare. There are specific genotypes associated with susceptibility to biotoxins. Approximately 25% of the population has a genetic inability to naturally clear biotoxins. Patients who have this genetic predisposition will need extra help from their physicians to clear the toxin using 2 drugs. The genetic test is called HLA-DR, and it is more commonly known as a test that provides insight into organ rejection after a transplant operation. One can use an interpretation guide written by the protocol's founder, Richie Shoemaker, MD, which correlates the HLA-DR findings to specific conditions that may be associated with multiple biotoxin diseases. The biotoxins can bind to toll receptors in the gut, in fat cells, or in cells that line blood vessels, resulting in immune responses and inflammatory processes. Matrix metallopeptidase 9, MMP9, is a superb marker for the presence of excess cytokines production from any inflammatory disease and is rarely used. I use this one for spine hacks. MMP9 may be responsible for delivering inflammatory compounds to the brain, which causes plaque formation similar to those seen in multiple sclerosis. In Lyme disease, MMP9 levels may skyrocket as the result of treatment with antibiotics and bacterial die-off, in what is commonly referred to as a Herxheimer reaction. We also see this with Candida die-off, for which MMP9 can also be followed. During this reaction, the symptoms usually get more severe. Cholestyramine, a drug used to lower cholesterol, can often mitigate the effect by binding the biotoxins circulating in the fat. If you're dealing with a Lyme disease diagnosis based on the HLA-DR array, you must first kill the spirochete bacteria and then go after the neurotoxin that causes the pain and obesity associated with Lyme. If you give a Lyme-infected person antibiotics and they are not Recovery is generally uneventful because they can clear the toxin by themselves without the help of cholestyramine or actose, a drug that helps control blood sugar. Actose liberates neurotoxins from the fats so cholestyramine can bind and eliminate it. An increase in cytokines may also trigger autoimmunity if the process is chronic. There are 3 types of antibodies observed in those with biotoxin-associated illnesses. These antibodies are to myelin, the protective sheath around nerve cells, gliadin, a protein found in gluten, and cardiolipin, which impacts circulation in the small blood vessels. There also may be notable increases in C3a and C4a. The C stands for complement, and C3 and C4a are proteins that work with antibodies and activate immunity. There is a significant difference in C3a and C4a levels between controls and in people with Lyme or mold toxicity. In fact, C4a levels become elevated, often as early as 12 hours after a tick bite. In the case of those with a mold-susceptible HLA type, C4a significantly increases within 4 hours after re-exposure to a moldy environment. C4a can be a helpful marker in determining whether or not a remediated home is still a danger for someone with mold biotoxin susceptibility. Where does leptin enter the picture for these diseases? The reason I became interested in these diseases was twofold. One, as a spine surgeon, a lot of people are referred to me with axial mechanical spinal pain, low back pain. Often, many have these other diseases and not spine disease. 2, all these diseases are tied to leptin biochemistry, and I learned to cure myself of a leptin illness, so I now happen to know a lot about how this issue connects to so many Neolithic diseases. This will become much clearer to you when you read the last chapter of this book. When neural biotoxins elevate cytokines and inflammation, leptin levels rise. When leptin increases, alpha-MSH in the hypothalamus decreases. Shoemaker found any biotoxin exposure decreases alpha-MSH, which is associated with increased pain and a propensity to gain weight. So with these diseases, we see leptin increase, alpha-MSH decrease, and patients become obese and very resistant to weight loss. When I learned about these links, it immediately made me realize how important leptin was in many diseases. These patients also become very sensitive to any painful stimuli. Alpha-MSH is the key finding in these neural biotoxin diseases as it controls the biotoxin pathways. With Lyme disease, chronic fatigue, mold illness, and any other biotoxin illness, regardless of the source of the biotoxin, we see a reduction in alpha-MSH in 95 to 98% of patients. This has huge implications for other Neolithic disease processes we will look at in the last chapter. When alpha-MSH levels are low, people also develop sleep disorders, chronic pain, and leaky gut, which increase inflammation even more. Because of this, their recovery from illness is often delayed. These patients may develop multiple antibiotic-resistant coagulase-negative staph colonization, MARCOS, although most doctors don't recognize this. When I see this on a pre-surgical screen, I realize we might have a large pain management issue brewing before the surgery even occurs. These patients tend to have frequent thirst as a result of low antidiuretic hormone, ADH, which can be associated with large blood losses from surgery. They also have low libido due to low sex hormone levels caused by inflammation at the hypothalamus. All these can be found with simple hormone testing. Alpha-MSH is involved in the production of melatonin and endorphins. This is why sleep and pain are involved in these disorders. This resulting lack of natural endorphins increases pain perception. When a physician says there is not disease called fibromyalgia, I get very angry. There is a clear pathophysiology present, but modern medicine has not tied the known information of these diseases together with the hypothalamic wiring in the brain. I came to understand these diseases by first understanding leptin and its relationship to inflammation. There is also another facet to the alpha-MSH story. The higher it is, the less pain we have. It appears that light and geothermal cycles regulate our MSH levels, and this is also tied to the leptin receptor because of evolution. The real reason is quite surprising. I believe it is to protect us from recurrent ice ages, which we have faced in our pasts. I will discuss this relationship and its implications for us in an upcoming chapter. Understanding the nuances of the evolutionary biology behind Lyme disease, fibromyalgia, and mold toxicity explains the many muscle aches and pains these patients suffer. It also underscores why they can't exercise well or lose weight, even if they push through their pain. The lack of understanding of the pathophysiology behind these diseases is why patients have become uber frustrated with conventional medicine. I hope now you understand it enough so you can navigate around what your doctors tell you without feeling bad about it. They just do not see what you now know. I do not want this disconnect in your relationship with your doctor to drive your cortisol levels higher, further lower your alpha MSH, and increase your pain. Alpha MSH also regulates the protective cytokine responses in the blood, skin, digestive tract, and respiratory membranes. Low alpha MSH results in cortisol abnormalities and fluctuations in ACTH, which regulates adrenal function. People with chronic adrenal fatigue often have biotoxin disease and rarely know it. Many who have a sustained leaky gut are susceptible to adrenal fatigue because of increased leptin and decreased alpha MSH. This is why people with adrenal fatigue are always tired, can't lose weight, and sleep poorly. It has very little to do with carbohydrate intake or a glucose deficiency. One way to assess this is to test your alpha MSH levels at the same time as your C4A levels. If Lyme is suspected, your infectious disease physician can run a CD57 test to see if you are chronically infected. If you are, you need to make sure the spirochete is killed before you proceed. An informed infectious disease physician or a primary care physician with Lyme training is critical in helping you navigate back to optimal health. Treatment. 1. If you are dealing with acute Lyme, it must be treated with 3 weeks of antibiotics. Then you must try to clear the biotoxin from the bacteria. I strongly suggest you seek an infectious disease physician experienced treating Lyme disease, fibromyalgia, or chronic fatigue. 10 to 15 million Americans suffer from these often misdiagnosed diseases. Most get labeled with other diagnoses, such as depression, chronic pain, IBD, etc. Why? Most doctors never learn about the easy visual contrast sensitivity test. This test is akin to a neurosurgeon looking at your optic discs to check for increased intracranial pressure. It is easy, cheap, and takes all of 3 minutes to administer. In fact, you can give it to yourself. If the result is positive, then you can begin to get the correct testing to assist your non-believing MD. Once you show him or her the other classic findings, those tests will force action. I see a lot of people who come to me for back pain who have these diseases. I start by asking 2 questions. 1. Are you sensitive to bright light? Patient. Yes. Especially at night, doctor. Headlights really get me. 2. Do your muscles constantly ache? Patient. Hell yes, doc, and especially the day after I do normal physical activities. After those 2, I make sure they are not on a statin that can cause the same symptoms, and then I tell them they need to do the VCS. Simple. If they have a positive VCS, I send them to the infectious disease docs who treat them to remove the toxin or kill the bacteria. 2. Cholestyramine, CSM, is a resin that has been used historically for lowering cholesterol. It is very effective in clearing biotoxins as well. It works within 48 hours of treatment, binding the toxins from the fat. It is very cheap as well. It has a positive charge that binds to a wide range of low molecular weight, negatively charged toxins, and helps shuttle them out of the body through the digestive tract. It is not systemically absorbed. CSM is like a vacuum cleaner that sucks up all the toxins released from your fat cells as treatment protocols proceed. CSM use usually leads to a dramatic fall in C4A levels. If C4A levels rise again while you're on CSM or antibiotics, you must assume the Lyme spirochete, mold, or neurotoxin is not eradicated and still present in your tissues. 3. Treatment for biotoxins may include Actose, a notorious type 2 diabetes drug. Actose was recently black-boxed because of its association with an increase in bladder cancer when used over a year. However, one can use it short-term in these diseases to help liberate neurotoxins from the fat cells or the lymphatic system to be cleared by the CSM vacuum cleaner. It has a significant number of physiologic benefits for patients with biotoxin-associated illnesses. Actose lowers leptin levels, lowers matrix metallopeptidase 9, MMP9, raises vascular endothelial growth factor, VEGF, and positively increases PPAR gamma, which causes fat cells to empty, all while improving insulin resistance and lowering inflammation. It basically causes our fat cells to dump their toxic contents so CSM can slowly remove them over time. For these diseases, it is precisely how we need to cleanse the fat of toxins. It is one of the most important interventions known in treating biotoxin illnesses, as it seems to block the cytokine storm or Herxheimer reaction that occurs in 50% of Lyme patients. The interesting thing is that Actos will not work if you eat a SAD. It works best if you eat a ketogenic Paleolithic diet because of its effects on leptin and cytokine amplification. How do I know I am better? 1. HSCRP levels approach 0 and cytokine panels normalize. Skin clears, asthma resolves, migraines improve, and your muscles stop aching. Your sleep magically improves quickly. 2. You don't have any unusual pain, bloating, indigestion, constipation, or other symptoms consistent with a leaky gut. 3. Intestinal permeability test. This is the simpler of the two lab tests. The other test is listed next. You consume a concoction of 2 non-digestible sugars, lactulose and mannitol, then collect your urine. Testing examines the content of the 2 sugars. In a healthy gut, mannitol is easily absorbed, whereas lactulose is only slightly absorbed. But with intestinal permeability, the lactulose is easily absorbed through the leaking gaps in the intestinal wall. This test can be ordered from Genova Diagnostics, www.genovadiagnostics.com. These tests are rarely used in allopathic medicine, sadly. If you're suffering from a disease linked to leaky gut, it is a great investment in my opinion. 4. Intestinal barrier function test. This is the more comprehensive of the 2 tests and analyzes a saliva or blood serum sample. It looks at the immune antibody levels to bacteria, yeast, and the most common food-intolerant dietary proteins: wheat, corn, soy, cow's milk, and egg. The levels of the measured antibodies determine what stage of development you are currently in. It also looks at the severity of the issues driving your condition, giving you insight into some of the common allergenic foods you should be removing from your diet. This test can be ordered from BioHealth Diagnostics, www.biodia.com.